Okay, we're continuing here with the book Prevent and Reverse Dental Disease. We're talking about amalgams, and the main thing in amalgams is mercury. Is it toxic? Yes, of course it is, and it's very dangerous and tricky in that, like mercury vapor has no valence on it, so you can inhale it. It can get across the blood-brain barrier. It can travel through the veins retrograde from the mandible, the maxilla, up into the brain. You can swallow it. It goes down. It's safer actually to swallow it than it is to breathe it and have it go up through your olfactory nerve. The amalgams outgas from your teeth, meaning that some mercury vapor is released continually from the teeth. Some countries have now banned it, but it's still used in the USA. If you're going to test it, people typically would test the blood and the urine, but that's a mistake because it only shows the very recent exposure. And you want more of a chronic sense, so you got to check the hair because a lot of people will be misdiagnosed as not having a problem with it because they only check the blood and the urine. The hair is a more valuable test. Um, and the most common exposure is from amalgams, but the next most common exposure would be from eating fish. So eating fish is a rather stupid thing to do. Women tend to excrete it better than men do in their urine. They'll excrete a higher percentage of it. So that's partly why they're less likely to have side effects from it. Okay, it's good to sweat. When you sweat, you help excrete mercury and other heavy metals from your body. Your sweat glands are like little kidneys. They filter it out of your body. You don't want to do a chelation test when you got amalgams because if you give a chelator when you got amalgams, they'll just pull it out of your tooth into your blood, so you don't want to do that. People have amount of Hg in their brains proportional to the number of amalgams. There's things you want to do to protect yourself. You don't want to brush over the molar surfaces with a toothbrush because then you just stir up more mercury vapor into your body. You don't want to use fluoride toothpaste because it dissolves more of it up into your body. You don't want to use toothpaste with whiteners because they're like bleach. They cause more Hg to come out of the tooth. You don't want to hold your cell phone to the side of your face because the low power microwave causes more Hg to come out of the tooth. You don't want to be drinking hot liquids, hot foods like coffee or tea because it causes more mercury vapor to come up out of the tooth. You don't want to chew on hard foods. It causes more mercury vapor to come up out of the tooth. Chewing is the number one thing that will increase vapor leak from amalgams, so you want to avoid hard foods. You don't want to chew gum. To chew gum with amalgams would be just absolutely stupid and moronic. Acidic fruits will also have some similar effect. Acidic things will do that, like lemons, grapefruits, and all that. And you want to avoid things that cause cavities because they can burn a hole around the side of the amalgam and lead it to need to be replaced sooner, and that could lead to mercury toxicity. Acidic foods bad also, like vinegar. They have more corrosion, cause more mercury leak. Don't brush with salt. Salt toothpaste causes more electrical current between the teeth and the Hg vapor. Wi-Fi has a little bit of a negative effect on it. Getting an MRI, but that's only a one-time thing. The only chelator that works well for Hg is MBMI, and it was developed by a guy named Boyd Haley, PhD. He's got a really good lecture at IAOMT, International Academy of Oral and Medical Toxicology, but he got screwed on the MBMI because it was shown to be effective for moving Hg from the body. It can go into the cell, pull it out of the cell, and then be excreted by the kidneys. But here's the problem. They can't patent it, and because of that, they can't make big money out of it, so no drug company wants to fund the necessary clinical trials to get big-time approval, so it's what's called an orphan drug, and it can't get approved. And that's very common that when something's actually useful, which is very few drugs, they get orphaned. They're not patentable, and so nobody wants to touch them. Some of these bioidentical hormones, 3-bromopyruvate for chemotherapy, it can't get approved. It's like, what the hell is this? So that's kind of sad because millions and millions of people all over the world need this thing, but they can't get it approved. And like I said, isn't that funny how 99% of drugs don't work, but they get funding and approval, and something really does, it gets orphaned, taken off the market. Okay, and like I said, the miracle thing about it is it can go into the cell and pull stuff out. All that other stuff can't do that, like the MSA, DMPS. They just don't work like that. They're nowhere near as good. Okay, and here's Boyd Haley's quote: "NBMI is unique. It can go into cells and pull the mercury out and then excrete it from the body. What more could you want?" He's a smart little sort of bulldog Irish-American biochemist, that guy. Cantankerous old guy, tells the truth. Let's see, what else? What else can you do? I talked about sweating. Let's see. So yeah, I'll even turn the heat up in the car to sweat. Some is excreted in the urine, not that much. Hg comes from hydrogyrum, hydra for water, gyrum for silver, like water, silver, quicksilver. That's partly how it got its name. Mercury was the Roman god. Like Hermes as a Greek god, the same one. He escorted. Oh, I also joke that just like the Roman god Mercury would escort people to Hades, Hg neurotoxin escorts them down below too. It's so toxic, it could do you a lot of trouble. Okay, see what else could we do. If you got a bunch of amalgams in your mouth and you have a bunch of saliva, spit it out. I talked about how it can cross the blood-brain barrier, making it more of a potent neurotoxin. Bacteria can convert the the elemental Hg to methyl Hg. It's still going to be nonpolar. It's still going to cross the blood-brain barrier. It can be used as a preservative. It often is. Let's see what else is worth knowing. It's very toxic to cells. It inhibits complex 1 of the intermitochondrial membrane. It binds to a thiol and sulfur group on a cysteine amino acid and inhibits it. Okay, so it's an intermitochondrial membrane inhibitor, mitochondrial inhibitor. Real high affinity for thiol groups. So this prevents electron transport. Not good. And it knocks an iron off the iron-sulfur complex. That iron's knocked into the matrix, which can then lead to the Fenton reaction and oxidative stress in the mitochondria. Okay, a little bit about electrical current. Oh, actually, maybe I'll do that one next time. I think that's enough to stop right here. I hope you found it helpful. And the bottom line is you don't want amalgams put into your mouth or your family member. If you do have them, what do? I have some, and I decided to leave them in because it's so difficult to find somebody who knows how to remove them. I did go to imomt.org, and they do have some people, but it's very hard. A lot of these people who remove them, they're so busy that you can't even get an appointment with them. They don't take any new patients. They're swamped. And you want to make sure that the person you go to removes them correctly. So that's why I decided to keep them, and I'm super meticulous with my teeth. I don't eat anything sweet because I don't want to damage my teeth. I don't want to have any problems with them because otherwise you can get a cavity around them and it can start to erode or start to fall out or leak more Hg. If I had to do anything, I would want the tooth just taken out, and I wouldn't even replace it with anything. The dentist will, of course, want to replace it with something like a ceramic filling or something, but I'd rather just have it out of there because the ceramic fillings I looked at had a 45% aluminum oxide, and I don't want aluminum in my mouth. And when you have two different metals, then you end up conducting more current, which can make things worse, more Hg, rapidity of vapor escape. So anyways, that's the scoop on amalgams. They're best avoided if possible. 50% of amalgams is Hg. Hope you found that helpful.